So when my
Hello, everybody. Happy Thursday Night Live. We are here with a chiropractor today. I'm so excited about this talk. We don't have enough chiropractors to come talk to us, so please send your chiropractors over. And if you know anyone, share this link with them right now so they can be in the conversation. Um, Hello, Shalom. How are you?
I'm great. How are you?
Good. Thank you so much for accepting our invitation to come on the
Yeah,
Airway
thanks for
Circle
having
stage.
me.
So we're going to share the screening just a little bit. I'm going to go ahead and introduce you. Here we go. Introducing Dr. Shalom Samuel, an airway-focused chiropractor who takes an integrative, whole-body approach to care. She combines spinal and cranial work, soft tissue therapy, and nutritional support to promote healthy breathing, nervous system balance, and overall function. She has advanced training in cranial and airway-centered care through Dr. Martin Rosen and Dr. Neel Bulchandani, who we love, with emphasis on craniofacial development, airway assessment, and tongue, jaw, and neck relationships. Dr. Samuel collaborates with myofunctional therapists and airway-focused providers to deliver personalized, patient-centered care aimed at lasting results. Today's topic is from spine to tongue to airway, a collaborative approach to patient care. Yay! Where are you located?
Sun Prairie, Wisconsin.
Awesome. You guys go over to the Airway Circle directory to find the best providers to either collaborate with. So if you have a patient moving somewhere or a family member that you're looking for a professional to take care of them. Do you have any audio on your clips, by the way, on your presentation?
I don't think so.
Okay, good. So whenever you click on the share button below, you'll be able to see your presentation. Otherwise, you have to do a little extra thing.
Okay.
So go to the directory. If you're not there yet, just add yourself. It is a free resource that Airway Circle offers. So click on the little plus and put all of your information. They're going to have to create an account in the directory software. Alrighty. Do you need any help?
On my way.
While you're doing that, this is playing April 2nd. So let's think April 2nd, what is going on in April? We should be pretty much done with foundations. Myo Circle is starting August 1st. It's going to be Myo Circle 8. No, 7. Oh my goodness. What day is it? Myo Circle 7.0. Oh my gosh, it's the 7th Myo Circle. I cannot even believe it's our advanced myofunctional therapy course. I would love to have you guys there. We take a small number of students to make sure the class is not too full and we can give everybody, a lot of our attention. It is 16 weeks long. It's the only advanced course in the United States, and it is very, very long. But it's incredible. We have lectures in there from so many different providers. We have the Brazilians that are all my friends and who I learned from, who came and it talks for us. So if you'd like to learn more, join us. It's open to dental hygienists, speech pathologists, dentists, doctors, PTs, and OTs. All right. Do you have your presentation open?
I think so.
There's a little button on the bottom that says share. Sometimes it's in green.
Yeah, I did it. Oh, all right. Well, thank you for having me. It's been a real treat, um, being in this journey, really. So my name is Dr. Shalom, as we've established, and I am a chiropractor by trade, but I'm trying to get my notes in here. I'm sorry. Hold on one second, Renata. So thanks so much for having me, Dr. Shalom here again. I'm excited to share my passion As mentioned below, before, I am a chiropractor by trade, but have chosen to be an airway focused provider because of my experiences. So thank you for this opportunity again. And a little bit more about myself and how I got here is I graduated from Palmer College of Chiropractic in Davenport, or as I like to call it, Davenhole, in 2012 with wanting to focus on family practice, pediatrics, and pregnancy. Little did I know that I would have kids who would change the trajectory of my process. And I worked as an associate at two practices in Arizona and in Middleton here, and then decided to open my own in 2019. I soon realized working with families that I could not create the change fast enough in an ever-changing world that affects our bodies and dealing with multiple systems and traumas on an everyday basis. Then I met Shirley Gutowski at Primal Air in Sun Prairie here at a networking event, a women's group actually. And then she could not stop talking about airway at all and how she needed an airway chiropractor to be in her corner. So I blame her completely for turning me into how I've become and evolved. And I'll share a little bit about how it started with my daughter here, as you can see in the picture, the baby there. And she had a lip tie, and how that is the turning point of how my career changed, in what I look for, how I work, as I got involved in learning more and more about the whole connection of the tongue and the body. And I've had more training from Dr. Rosen and in his teachings with the cranial work, with SOT, sacro-occipital technique, and also from Neel Bulchandani in the floor of the mouth and his fascial work as well. So why does this conversation matter? You know, in healthcare, we look at separate silos, as I like to call it, you know, eyes, teeth, nose, mouth, hands, and systems. But when you look at one body, though, they're all connected, right? For example, where's your tongue right now? Can you feel where your tongue is? Try moving it around and then keep it in the floor of the mouth and try turning your neck side to side, compared to do a suction, have it in the palate of your mouth and turn your head side to side and do movements. You will definitely feel a change. So what does that prove? You can feel the effect of the tongue, how it changes your rotation or lateral movement. You can feel that you can move farther when your tongue is actually in the right place. So that's just simple exercise shows that things are connected, right? For example, our jaw is only structured with bone at our T and J joint. All of these muscles here are just hanging. And as we know, with any muscle, unless you work out and practice, you kind of lose its form. So the body is more at ease when you have support from the tongue. So we're all connected. You're going to keep hearing that word over and over again, connected, interconnection. So we can't just look at one system and figure the root cause of any problem or pain, because it affects each system in our body. For example, here, the picture of the nervous system that connects the brain and the spine to the rest of the body. And then you add muscle and fascia to all of its layer. Again, you see all that connection. The brain talks to the rest of the body through the spine, and the nerves that exit through it. Like for your brain has to tell your leg to take a step and walk. All those movements have multiple interconnected parts, and you can't do one without the other. And then you add outside forces like chewing, eating, traumas, and all of those things also have an effect. So when we figure out what the root cause is, kind of like peeling an onion layer, we are figuring out the structural and the neurological component of each segment. So the body as one system, because again, we are so interconnected with our systems, bones, muscle, and fascia. Tension and dysfunction move throughout the body instead of just staying stagnant in one spot. So our body is always trying to find the balance, and compensation affects that. For example, let's say we fell on our butts when we were kids, which happened often. We learned to ride bikes, we learned to walk, we learned to crawl, and that has an effect on our spine. Even though we may forget that we fell, our body doesn't forget. It keeps the score, right? So compensations affect how we walk. So if we hit our head or have a traumatic birth experience, we got stuck in the birth canal, our neck is not going to be as optimized as possible. So in order to compensate for that trauma or restriction, our shoulder has to compensate for that. If the shoulder goes up on one side, the hip has to go up on one side. If the hip goes up, the knee has to bend on the other side in order to compensate, in order to have the most optimized way we could breathe and walk and exist. And coming to this, I'm going to introduce fascia. I'm sure you guys have all heard of that, but there's so many fascial lines. You have the superficial back line, frontal line, arm line, spiral lines, lateral lines, functional line, and the deep frontal line, which I'm going to focus on a little bit more because it's the only one that is three-dimensional and the one that actually starts where we're more concerned, the tongue, and it goes all the way to your toes, wrapping up many organs and tissues. So this is a perfect segue into why fascia is continuous and why we have to look at many parts of the body in order to address one muscular organ, our tongue. So here's the deep fascial line that starts in the oral cavity and goes all the way to our toes. And I love this book, The Anatomy Trains. I read a lot in there. And I love this segment where he talks about common compensation patterns associated with the deep fascial line. And those are things that we see in everyday families that we meet. Babies that are toe walkers, chronic ankle sprains in runners, knee dislocations often, or shoulder dislocations, bladder incontinence, hard labor, back pain that doesn't go away no matter how much you get adjusted, shoulder breathers, not involving the diaphragm at all. I always keep on harping on my athlete runners to have their mouth shut while running because they're not engaging the key concepts or core mechanisms of breathing at all. Loss of cervical curve. Maybe someone had a car accident and that made them have neck issues and they are losing that curve, but really, did the accident cause it, or was it a tongue postural issue that implemented the loss of cervical curve? TMJ issues, chewing, we hear clicks, they hear clicks. How do we address that? Swallowing. I was so surprised to learn that the deep fascial line compensatory mechanism is swallowing issues and also speech and language difficulties that we see in kids a lot. So this line is really important for us airway providers. So what is connecting the top and bottom? Okay, we talked about the tongue being an issue, and the deep fascial line, and how does that affect the other muscles in our body? So for example, here we have the psoas muscle. It's a major supporting muscle, but as you can see in the anatomy, it connects the lower back to the hips. So it basically bridges and wires the connection between the spine and the legs, joining the upper half to the lower half, breathing through the diaphragm to walking, and acting with other local muscles in the complex way of steadying our movements, walking, running, sitting, etc. So you can see how the fascia gets, if it is tightened in there from the tongue, it transcends through the ribs into the diaphragm, and it passes its pressure into the psoas muscle here. So oftentimes I'll find the low back pain that doesn't go away, you work on the psoas and it eases it. And then you look at a little bit deeper, the tongue is not in the right spot. The posture of the tongue is wrong. The floor of the mouth raises when they lift their tongue. Hence, the psoas muscle is being affected, hence the low back pain that never goes away, no matter how many times you adjust it. So imagine a pregnant woman has an effect on the baby, right? So I have a lot of people that come in for my baby is not turning to get ready for birth. So imagine if the psoas is tight because of fascial tension, the baby's not able to turn in utero, so the mom could have hard labor for birth. And it's a domino effect from one muscle to the next. So the deep fascial line is affected when the tongue is not in the right place. More importantly, because it's three-dimensional as well. And then, which affects oxygenation in pregnant moms. And then again, the domino effect that affects the baby as well. That's just one muscle. We have many muscles that work like that. So let's get to my favorite part is the spine, right? That's what I was trained in, looking at the spine in different various aspects. So when I first started practice, I would look at posture. Oh, it's their spine is misaligned. Their spine is misaligned, and we get to adjust, adjust, adjust. So why do these happen? Yes, thoughts, traumas, and toxins do cause spinal misalignments, but why is it that, forever thing every week? And I'm one of those weird chiros that don't want to see my patients every week in and out. I want them to heal. I want them to adapt to their stressors in life, to the environment around them. So I'd like to see them a few times. Then I push back. They're holding their adjustments 3 weeks, 4 weeks. They're still holding their adjustment. I won't see them for about 6 weeks. Or some people have really high intensity jobs, like hygienists, that our hands and their bodies are demanding for their work. So I see them more often. But regularly speaking, you should be on a maintenance scale. You should not be coming in every single week. So that got me digging into for example, for my daughter, is that her neck would always hurt. This kid, she was an emergency C-section, but other than that, has been fed well, has been adjusted all her life. And why is she having neck problems at age 5, age 6? Why can't she grow her hair like she wants to because of the heaviness of the hair that would used to pull her neck? So anyway, getting back to the slide is that the cervical spine should have a nice curve in the neck, moving the head and neck in different parts. So when it has a nice C-shaped curve, it has enough space for the nerves to get across to wherever it needs to go. So from the cervical spine, it goes to the eyes near throat, to the neck. The cranial nerves go into the cranium. And then at the base of the neck, it goes to your hands, heart, lungs, your breathing. For example, asthma, high blood pressure, low blood pressure, all of those are regulated by those nerves. When the tongue doesn't live in the palate, airway gets smaller. So the spine has to compensate by moving forward. So remember when I said the body is always in balance, it wants to balance itself, and it's going to prioritize the much needed things like breathing, for example, than how you look with your head, whether it's straight or not, or the hair on your head. It's not going to care. Breathing is much more important. So it's going to compensate by moving forward. Our head moves forward to create the space for the airway. And that comes with a price, right? For changing the center of gravity and the mechanical stress, it's going to add to the hyoid and the tongue and the whole complex underneath our jaw. So that puts a lot of pressure on the knees, the neck, and back. And it's like a bowling ball, our head. So imagine the center of gravity that changes. Everything else beneath that has to compensate for that. So imagine the neck having that nice curve is like a hose. Why do we garden? I mean, what do we need to garden is water, right? You imagine that hose that's filling up our garden with water and giving the plants the nutrients that we want. So that's a nice C-shaped curve. Now, so when our neck goes forward to compensate, it becomes straighter, putting pressure on the nerve. So imagine a big old truck on top of that big hose. So now is there water coming out? The same analogy goes here. Nerves are being pushed by the compensatory mechanisms, and the supply of nervous system function, supply of blood, supply of communication is all halted. Big old truck on that hose, our body's compensatory mechanisms putting pressure on the neck. And therefore, if the neck is compensated, then you're going to feel that throughout the spine, in the thoracic, the mid back, and the low back as well. So the cranial base, another favorite of mine, is working in the cranium. You should ask Shirley on how long it took me to wear gloves and start looking in the cranium through the mouth, because I was hesitant. Well, I didn't want to wear gloves. So it took me about 6 months to buy gloves and start this process. So what does the cranium have to do with breathing? The bones of the skull, as you can see here, maxillary, palatine, vomer, sphenoid, temporal, and occipital, they all have suture lines. And the skull, although we're told they fuse at certain ages when we're infants, they don't completely fuse solid. So they're connected by subtle rhythmic motion throughout our life. So they are able to move. So the motion is derived by what is called primary respiratory mechanism. So whenever we take a breath in and out, so inhale and exhale, there's a dance that happens between the cranium and the sacrum. So that's that connection. So when you inhale, the cranium moves one way and the sacrum moves the other. And then when we exhale, the opposite happens. So this needs to happen in order to have proper cerebral spinal fluid move through our brain and spinal column, and many other important things like calming our nervous system down, etc. So this dance can get compromised when our cerebral spinal fluid is not flowing right, maybe from that birth trauma. A lot of kids you may have known that grind their teeth, or even adults grind their teeth or clench their teeth, is because it's the body's innate mechanism to elicit the cerebral spinal fluid back. So moving your jaw back and forth or clenching will get that cerebral spinal fluid going. I have also heard of kids that would hit their head against a wall, another way of adjusting their spine and getting their cerebral spinal fluid back into gear. The motion of the cranial bones can change from the very first trauma for humans is birth, from a fall or a birth process, and that can cause that dance to be altered. Mobility of the sacrum from birth trauma or a fall can change that. Tension in the dural membrane, so the fascia in our brain and spinal cord is called dura, and again, birth trauma. Do you see a pattern here? A lot of birth trauma is happening. Nervous system regulation, so birth, that's why we take an extensive intake, because our systems are so interconnected. I want to know how your birth was. Was it too fast? Was it too slow? Did you breastfeed right away? Did you breastfeed? How long did you breastfeed? Did mom have any complications, insulin resistant or hyperglycemia, any of that? And then we're looking at a whole body approach. So we're looking at emotional stress, mental stress. Were there any stressors when mom was pregnant? How did that affect the baby? And physical realms in the health of this individual, that environmentally speaking and internally speaking has to be processed, so that because all of these influences influence our spine and our tongue. So together, these create gentle expansion and contraction pattern of the cranium. So it's technically moving. So these sutures are not fully sewed together. So literally, just like our lungs, the skull breathes. So when that motion becomes restricted, function of the cranium, hence the tongue, changes. And this could be the reason why we're not able to clear lymphatics. We're not able to drain it properly, not able to communicate with the rest of the body, and the nervous system is not able to rest and relax. We're always in a fight or flight mode. Something's always chasing us. So the bones here, I have a little skull. So as you can see, this is our palate up top. And when this palate, how does that expand organically? When our tongue is up there. But as you can see, the floor or the palate is also the floor of the cranium, and it attaches. If I take the frontal bone off here, you can see that all of these bones are interconnected. So if one moves, everything gets affected. So you'll see how this you can actually monitor and see in a person. So the palate acts as a scaffolding in order to develop the whole sinus and expand the palate. So this is what the cranial influence of the tongue is. So the cranial base, the tongue acts as the rudder for the spine and the cranium, and the base to hold the proper posture. So when this doesn't happen, it has compensatory signs like the spine and the things that I previously mentioned. So, and then oral restrictions also make it hard when trying to get that tongue to the right posture. So, and then the tongue and the palate are also is a neurologic circuit that connect the nerves from the cranium to the rest of the body. Also keep in mind that, again, the palate is the floor of the nose. And if the palate is nice and wide, so is the nose. Therefore, you optimize and increase oxygenation. So as it says in the slide, it influences nasal passages, the maxilla, the growth of the maxilla, palatal shape, the position of your hyoid, this bone that's hanging out here, and the tongue space as well. So when the cranial base or the motion of it is restricted, you can have narrow palate, airway loses its volume, the tongue drops or compensates forward with the neck, and everything gets tight because it's out of structure. So improper structure equals improper function and development. That makes sense, right? And the body prioritizes breathing more than keeping the neck or the head straight. So it's going to do whatever it needs to keep breathing open. So like I said before, this is a muscular organ. It has 8 muscles, intrinsic and extrinsic, but it is the main postural organ. So at rest, it should be up there. Again, closing that neurologic circuit is vital. So it's not just for eating, swallowing, but it affects posture. Again, it's made out of 8 muscles, innervated by all the nerves that you know, the vagus, facial, lingual, and glossopharyngeal. And the closed neurologic circuit is essential to calm the nervous system down. And when the tongue's not up there, we see a lot of kids with anxiousness, and because they're always in fight or flight mode, right? The bear's always chasing them, and the body has never been able to rest and relax. So trying to preserve the body from harm. And the tongue, again, defines the posture. So when you see high shoulders, one side is up, one side's down, hips are uneven, ears and eyes look like they're not even, we know that there's a component of the tongue that is the root cause. So oral tethered tissues, the space we live in, right? We have anterior, we have mid, posterior, buccal, and lip ties. More than just visuals, we need to look at the functional aspects, and the assessment matters more than just the visuals alone, how it's affecting them. So we do functional assessments that are super comprehensive, like I mentioned before, like from birth to now. Collaborative processes are better because you get different perspectives. Like a dentist intake is different from a myofunctional therapist intake than my intake. Therefore, we're able to get a comprehensive approach to physical, mental, emotional abilities. So how are they functioning? Many tasks and their behaviors around the people they are. We take a dental history, like how many times they've had braces on or Invisalign on, or how many teeth extracted and why. Are there tori in there? How is the palatal formation? Are there bumps? Are there grooves? How's their sleep like? What is their diet like? What are their activities? What were their activities before things changed? And we go a couple of generations back because we want to know how mentally and emotionally it got affected. Maybe their grandpa was in the war. and got exposed to reagents that they used. And maybe they lived by the farm and the switch was, a 10 years ago, they switched to the city and the water change. All of these things matter. That's why an intake is so important because it could have altered their DNA. And we want to make sure that going forward, it doesn't alter the generations going forward. And with a collaborative care, when you have different perspectives, you're actually correcting the root cause for a longer term. What are the implications of potentially releasing a tongue tie now versus 10 years? How is their quality of life going to change? And we can predict what could happen because we are in the business of prevention, not just cure and care, right? And experience has taught me to be more proactive just with my daughter's situation and the people that come through our offices is that I used to be the conservative one. Let's see what happens. Let's see how therapy and unwinding fascia can help. But as years go by, I want to be more proactive in releasing that because I see the 70-year-olds, I see the 67-year-old pain patient, that all of this stuff could be reversed or not even she doesn't have to go through it if these things were addressed as a child. Here's a patient of mine, the bottom picture, who couldn't swallow at all. So every time she ate, she had to turn her head a certain position in order to swallow. So there's that throat, hyoid, tongue suspension that was in dysfunction, right? And she could, every time she would eat or drink, imagine that you had to manipulate your neck a certain way and head in order to swallow. That's not a quality of life to live with, right? She started myofunctional therapy along with chiropractic and cranial body work. And then she had a release and she's in her 60s. She was unable to eat or sleep without discomfort in her neck. Now she's able to swallow and sleep and not snore. So the compensatory patterns take over at one point or another. When we're young, we're resilient, we're able to overcome it. But when the compensatory patterns take over at one point or another, that stops us from us doing everyday life, like eating and drinking. So what do tongue ties and restrictions have to do with posture? So again, whole body compensation. Look at the head shift here in this 18-year-old. There's a shoulder imbalance. There's the kyphotic curve happening in the thoracic region. And this is all driven by tongue posture and airway adaptation. Again, collaborative care matters. The adjustments I do for the neck and the head and the back are not going to hold it all. And that's not my concept of healing when you have to keep doing the same thing over and over again. That's not healing from within. Yes, it helps the body at that moment, but once they're out of my office and do their regular things, it comes back. And that's not adaptation. And the body is not able to adapt because there's no right alignment. The rudder, the tongue, is not in the right place because the body is prioritizing breathing and therefore has to compensate. And this is an 18-year-old, like I said before, and we're collaborating with a myofunctional therapist and an orthodontist, including nutrition, and he's a runner. So I'm recommending that he mouth tape while he runs, and that has made a huge difference. Training him to close that circuit, right? The tongue and the palatal circuit. And he is, I've only seen him twice so far, but he's made lots of improvements. Tongue ties and scoliosis. So again, like I mentioned before, postural changes happen because of compensation. And here you can see how, when she's doing the suction, how tied her tongue is. And she has a lopsided neck, right? Because doing that suction causes all the muscles to be strained, and therefore she has to be lopsided. So there's a lot of cranial torsion in this case. So I'll go over her case at the end as one of my slides, but this is stress association, not causation. So this is why early screenings are so important. You'll see how you would think this person has scoliosis, which she does, but you'll see later how this has changed from collaborative care. Compensation of, like, look at her jeans pant seam, like it's not even straight. Her neck is somewhere else, and her hips are somewhere else. We are finding more and more that tongue ties are associated with some sort of a scoliosis because of the push and pull of the fascia in order for airway to happen. So again, prevention is better than cure. And if caught early, hopefully before puberty, it can be avoided or even reversed. So what does airway look across lifespan? We already mentioned mouth breathing. The tongue is not resting in the roof of the mouth, therefore not developing the sinuses, and kind of a stopped halt on the cranial development there because airway is compromised. So they're not using the God-given nasal potential of breathing, right? So the palate doesn't expand. So we'll see tooth decay in kids because that's not how you breathe. You have to use your nose where there's a filter to filter the air. And then from the mouth hanging, because of the open mouth, we'll see a lot of TMJ issues, snoring and bedwetting because you're not in the rest and relax stage of the nervous system. At night, we're supposed to rest and relax, rejuvenate, clear lymph, clear blood, and less anxiousness. All of this happens only when those things happen. So we don't get deep sleep if the mouth is open. Often these are misdiagnosed as ADHD, learning difficulties, daytime sleepiness, chronic fatigue because they're not rested well, and poor immunity because sleep, restedness increases your immunity. But if you're not getting that, you're more apt to getting sick. And then how does this translate into adolescents and adults? Well, you get increased risk of long-term health issues like high blood pressure, diabetes, other metabolic problems, heart conditions, and then ultimately obstructed sleep apnea and pain in adults. A lot of pain people because of not getting enough sleep and the right oxygenation. We're seeing 30s and 40-year-olds with the CPAP. How is that a good quality of life? That especially because these things can be avoided. Just statistically speaking, 100 million individuals suffer from sleep apnea, which leads to all of these conditions: gout, Parkinson's type things, diabetes, high risk pregnancies, not being able to metabolically lose weight or gaining weight, dementia, sore throat, liver issues, stroke even, because good quality sleep with the proper oxygenation is so important to have a good quality of life if certain things are addressed at a younger age, or the best time to do it is now. So why working alone was great in the beginning. Starting my own practice, working alone was great because you see results and you kind of want to think you're the sole reason they're getting better. But it's not long lasting. And I want to see my patients live pain-free, thriving lives. And that's why I got into chiropractic, is that without medication, without any huge interventions, you are able to work on the spine and make them feel better. And our bodies should be able to heal without being dependent on one treatment or weekly treatments. And patients get frustrated, right? And the outlook is so different when we look at the lack of integration. And I hear it day in and out of my patients talking to medical providers, and they have to keep repeating the same thing over and over again to the nurse, to the next doctor. And there is a missync about that, right? They should not be working harder. They should be working less at explaining the situation, because we all came into the medical field to help people. And if that help is super hard to get and not working, then what's the point? Again, same thing. One body that is connected as a whole, but we keep addressing it indifferently. Not that different opinions are bad, but at the same time, how does that make sense? Or how is that benefiting the patient in the long run? Not just now, but in the long run for generations to come. So this is partly my collaborative team and model. So we like to give it a name as an integrative care because we're integrating multi-professional atmosphere in that medical model. And it usually has to have myofunctional therapy with my collaborative team, but we also collaborate with dental and medical providers. Other providers could be osteopaths, naturopaths, nutritionists, whole body nutritionists that involve butter, and orthodontist specialists, especially pediatrics, because not a lot of specialties or orthodontists do expansion or believe in expansion for little kids. So that's really important. And then also involving TMJ specialists. Like I mentioned before, the TMJ joint, a lot of people, even kids now, have a lot of issues with because they're mouth breathing. And there's no way to exercise those neck muscles if their mouth is open all the time. So this is my oldest. Her name is Addie. And like I think I mentioned before, she had an I had an emergency C-section as she was stuck in the birth canal and the cord was wrapped around her twice. So I never knew about any of this until she was about 5 or 6. If I only knew what I know now. And she never latched for breastfeeding, and that's the number one sign. Ding, ding, ding. Something's up with her tongue or oral cavity. And growing up, she had neck pain. She had severe constipation, even with the best adjusting and foods. And she always wanted really long hair like Rapunzel, but couldn't grow long because the weight kept pulling her neck down. And she never put on any weight, and she was super what's the word? Not self-confident, crying for everything, very emotionally unstable, dysfunctional person. And as a mom, you don't want to see that for your kids growing up. You want them to have happy, thriving lives. So she had a lip tie, like I mentioned before, and when she was 6 or 7, we did the release. She had myofunctional therapy, and she was very diligent with her myo brace every night. So in the previous slide, I don't know if you can tell, but you could see her teeth, that the lip tie was separating the front 2 teeth, and they were jagged. So one was up, one was down. In this is how she looks now. As you can see, her hair's longer. Had intraoral cranial work from me, myofunctional therapy from Shirley, and surprisingly, I never expected that her constipation went away. She's a healthy weight and is more confident, and happy and thriving, like how every parent wants for their child. And this is what got me started in airway health and why the tongue needs to be assessed, because it affects a lot of things. I never knew at that time about the deep fascial line and how it coats all of the organs and tissues. And so now I can put it back together that the lip tie also affected the tongue, and that her tongue was not in the palate, affecting the tightness, and that tightness transcending through the small intestine, large intestine, being tight and non-relaxed, hence the constipation. And because the neurological circuit was not closed, she was anxious, she was emotional, and not sleeping well at night because the deep restful state of sleeping was not there. And so she was always anxious, she was always emotional, and now she's so much more regulated. Here is another patient of our collaborative group, 4-year-old, came in with his shirt fully wet. And we were like, oh, did he spill water? And the mom said, no, he just drooled a lot. So constantly his mouth was open. You can see in the first picture how red his skin is around the mouth. And you can even see some wetness in the chin because his mouth was open all the time and he drooled so much that his shirt would be soaking wet. So he had cranial work, OMT, and again, circuit, not the neurologic circuit between the tongue and palate was not closed. So there was a neurologic deficit. The brain, mouth, tongue, and the body connection was lost, so dysfunction. And the rest of the body and the nervous system was not calm at all. So once we started to get the nervous system to calm down, then gave him exercises for the tongue, and he was diligent in doing them. This is the second picture at the bottom. That's about after 18 visits or so over the course of 4 to 6 months. And as you can see, he's not as red. His ears are more even, and his mouth is closed and not drooling. And he was also all over the place, super hyper. This is a 67-year-old patient, and this is her testimonial. When I said I was doing a talk, she wanted to give a testimony, and that she still is struggling. And I saw that her pain could be decreased with spinal adjustments, but the root cause was her tongue. And even after her release, she had myofunctional therapy before, but not as much after. Her tongue posture was still not good. She was still bringing all the floor of the mouth up. So I recommended her to Shirley with OMT, and that boosted her healing capacity to go so much faster. So as you can see, she has improved breathing, better sleep, and the fascia is so much more at ease that things are shifting now. She doesn't have the same pain day in and day out where she couldn't go for hikes. She couldn't hang out with her husband for too long, like doing traveling and stuff, because she was always in constant pain. So these are the stories that we look forward to because this is transforming, you know. So what can you do? What is our call to action? Is you can integrate it in 3 easy steps. First, don't just look at the tongue. You have to look at the whole body. You have to look at how the head is sitting on top of the neck, how the ears are situated, how the shoulders are, how the hips are. And when you look at that, we look at the head tilt and high shoulder or hip, you know that there's a tongue involvement. And does the hardware match the software? Like if you are moving teeth or releasing a tie, make sure the foundation, which is the spine and connected fascia, is also being addressed at the same time. You can't do one without the other. And, you know, start a pilot case, identify a patient in your repertoire in your week and who have plateaued their care or not seeing improvement, and try to co-manage them with like-minded providers. And preconception work with patients, right? How is the parents' sleep? How is their nutrition? Epigenetics plays a big role. Do they have oral restrictions? Do they have scoliosis? How is their tongue posture? Palatal development starts at 6 weeks gestation and continues through childhood. And what does that mean if you see a cute picture of a baby sucking, which means even in utero, their neurologic circuit is not closed. So therefore, sticking their thumb in closes that and soothes them. Apoptosis, cell death, happens at 12 weeks gestation, which means that tie under the tongue should separate on its own. But why doesn't it happen? But if you do preconception work, telling the parents to get tested for MTHFR gene, that, conjugation of some supplements is not happening in their body, they can do work. We can help them get nutritionally sound in order to bring the next generation into the world without any issues. And the next best thing is at birth. And the next best thing after that, time-wise, is now. Checking and working with like-minded professionals to unwind the fascia, to release them of all this tension Prevention better than cure. So this was a referral from Shirley Gutowski to me because this person came in with a lot of tension and she had jaw pain. This is the same person I showed with the scoliosis. So she had a lot of postural changes, but this is a collaborative success because she was taking 2 to 4 Tylenols every day for about 5 years because her pain was so bad. She was changing into a different person. She wanted the pain gone because she treated the people around her with a bad mood all the time and she couldn't sleep well. So you know how it is when you're in pain, not sleeping, of course you treat people not as how you would like to be treated. And she has braces on and she does have a tongue tie, but just with calming her nervous system down, this is her testimonial. And this is after 12 weeks of working on her nervous system and cranials. So the root cause is the tongue. It will need to be released eventually, but working with the compensatory patterns, it's like peeling onion layers. But this is a clinical result of a measurable importance, right? She is not taking any meds right now as of January 31st, 2026, I believe. That's what she wrote. So we are the only ones that can bridge this gap from 3-year-old development to a 67-year-old pain patient. So don't just refer, build a collaborative team and join the movement of collaboration. Let's not just make sure our patients survive. Let's help them thrive for future generations. And we need to stop, looking at silos in our own realm. Every patient carries a story. Every patient has a pain, they have compensation, and they're trying to survive in the midst of all of that. And when we address the spine, the tongue, and the airway together, we actually stop chasing symptoms and we start changing lives, as you've seen with some of the testimonies. Collaborative care allows us to see the whole person and not just the problem. So thank you for being part of the movement that restores function, breathing, and hope. True healing doesn't come from just one provider, one technique. It comes from understanding all the connections from spine to tongue to airway and honoring the body's potential to heal from within, given the right support. So when we collaborate, we empower patients, elevate outcomes, and redefine what's actually possible in healthcare, which is true healing. So thank you for having me.
Yay! Thank you. That was a wonderful presentation. If you can please stop sharing your screen and let everybody know first, how can they find you? Instagram, website, sorry, I got a cough. Instagram, website, phone number, email, what's the best way?
Yeah, email would be just my name and then DC at the end. So Shalom Samuel DC at gmail.com. And you can also check me out at shalomfamilychiropractic.com as well.
Yay, awesome. Thank you. And yes, it's all about collaboration. How amazing when all of these different healthcare professionals just start getting a little bit of a glimpse of what the other professional does. And all of a sudden you go, oh, what I do makes so much more sense. And we need to work together. It's not just treating one part of the body. We need to treat everything. So
yes,
thank you for sharing that. I'm going to ask you some questions and we have answered them already in the presentation. However, we do this for social media. So here we go.
No problem.
To begin, can you explain how spinal alignment influences airway function and breathing patterns?
Yeah. So our very first trauma is birth. So when we come out, we are pulled and prodded in different directions, whether it's this way or that way, whether it's a C-section or not. It's actually worse with C-sections. But that's why I'm a very big proponent of checking babies as soon as they come out. Because again, talking about compensation, we learn to walk, we learn to crawl, we learn to ride a bike, we fall, we bump our heads, et cetera, and patterns start forming at that time. When we don't address that, and then you add things on top of that, like a tongue tie or a lip tie, or your posture of your tongue is not right, then you are making way for compensation with the spine. So when the spine moves in different directions, again, your body is always going to choose breathing and oxygenation than anything else. So it's going to move that spine accordingly and therefore closing that airway. So moving your head forward, forward head posture, and then closing that airway. When we have that neurological circuit with the tongue and palate, it keeps the spine in check. That's why chiropractic care is important for nervous system function and airway function at the same time.
This is what I always say. I don't want another baby, but I want another baby. Just like to massage him so much.
Right?
Like, I wish I would have known this. Even when I had Benny, it was 6 years ago, I already knew some of this stuff. Like, I just wish that we know that we have to really release and massage and get these babies moving how they're supposed to be moving after they've been, you know?
Yeah.
And then through the, not only in the uterus, but then through the trauma of being born.
Yeah.
And then, of course, natural births versus C-section births, the total difference of what happens. So
because the primary respiratory complex doesn't happen when you have a C-section baby. They're not squeezed down there. So that's a big
both of mine.
Big issue with that.
And both of mine. Many clinicians don't immediately connect the spine, the tongue, and the airway. Can you walk us through how these systems interact?
Well, like I said before, the spine, the tongue acts as a rudder to the neck, the cranium, and the spine. So if the tongue, imagine the head of the ship, the rudder, the person that moves it, the captain or whoever, that is not functioning right. So how do you know direction? How do you know depth? How do you know where anything is? Like nothing's connected. Once that connection happens, the rudder functions right. You have direction. You know where to go. You know what is forming, what is not forming. All of these things are simultaneous. That's why you have to work with myofunctional therapists simultaneously when getting ready for a release with a craniopath or a cranial person, you know, because they all function together. If we look at it in separate ways, the healing process is so much longer than when you connect all of them together. Like the little boy we showed you, if I would have just worked on him, yeah, he would have been better, but there's no way he was going to close his mouth. You know, he would have still been drooling and he wouldn't hold any of his adjustments. So I'd have to see him every week for the rest of his life. Like that's not what life is about. Until you train his tongue to be where it's supposed to be and make that neurological connection, all three don't work well.
From your perspective, what are the most common spinal or cranial findings you see in patients with airway dysfunction?
So the floor of the mouth, thank you, Neel. I was just so fascinated with his work that I just wanted to learn more and more and more. But the floor of the mouth always lifts, and it's supposed to be at the floor of the mouth, right? So with that comes certain patterns that he's mapped out. For example, the right shoulder. This is spinally speaking, right shoulder, diaphragm, sternum, especially the manubrial part of the sternum, the knee, and the ankle, the Achilles. Cranially speaking, the floor of the mouth and the sphenoid bone, way in the back, and the pterygoids are the majority of the ones that are out, and then the sinuses too. Because we can see the offshoot of the eye sockets as the bones here, the temporal, frontal, and maxilla form the eye socket. And if those are misaligned, they're going to look off.
Wow. So many patients like that. What role does the tongue, jaw, and neck relationship play in posture and nervous system regulation?
Yeah, they all have to function right in order to have the rest and relax phase of the nervous system. So as many of you know, there's two parts to the nervous system, right? You have the fight or flight mode and you have the rest and relax. So the fight or flight mode should be only when you need to survive, like a bear is chasing you, or I don't know, you fall somewhere and there's no one around to take care of it. So like your primal instincts act up so that you know surviving. So I need blood to my brain. That's important. I need all my limbs and my heart needs to beat and I need oxygen. Like those are top. But in this day in society, we are always running like that because we have the next thing to do. We have kids to see. We're seeing multiple things. So sleep becomes vital because only when we're sleeping, we're able to get into that rest and digest phase. But we don't sleep. So when are we getting that rest and digest phase? So that's why nervous system function, we need to close that neurology in order to get the rest and digest phase. So we're not anxious. So our kids are not, misdiagnosed with ADHD and so on and so forth. So they'll all have to work together, and the nervous system, to be at its utmost potential, needs to have the tongue living in the palate.
Amazing. I went to a functional medicine doctor yesterday when we are talking exactly about this, how
Mm-hmm.
people's posture, just having your shoulders rolled forward, your head forward, it puts you immediately in a fight or flight. I mean, if you
Mm-hmm.
look at a dog, right? I'm not sure who told me this or where I read this. It might have been here on TNL. But if you look at a dog, and when a dog is happy, they have good posture. The tail's up, the head is up. But
Yeah.
if they are either afraid or if they are stressed or anything like that, they kind of crunch up. And it's the
Mm-hmm.
same thing with humans, but we are walking around like this, and it's
Mm-hmm.
our natural posture.
Yes.
And my goodness, how much that affects all the internal things that we don't even know about.
Yeah. And in that same realm, if we were on a hospital bed and we had our mouth open and sleeping, we wouldn't get enough oxygenation. It would keep beeping. We would have to be resuscitated, the amount of, obstructive sleep apnea that people are walking around. But because we're walking
Mm,
around fine, no one sees us that way. It's that
wow.
in that stage, which is sad, but there's hope that we can help these people.
How much did this change getting to know this knowledge? How did you even find these people, first of all? And then how did this change the way that you treat your patients as a chiropractor?
Yeah, I joke around saying I don't really hear any sounds anymore when I adjust people. It changed from my daughter and wanting to learn all of these things. And it really helped that Shirley was in my corner, always telling me, you need to go take this class. You're not, you need to buy gloves in order to check people's mouths. And her telling me that you need to focus on the airway. And I always wanted to be in this profession to change lives, to make people better. And what I was doing with just adjusting, not that it's bad or anything, it did change lives, but not to this drastic effect because I wasn't addressing
Mhm.
the root cause. No matter how much I turned the wheels, the spine, they weren't going anywhere. They were getting misaligned all the time. And it made me wonder, like, God didn't make our body to be so broken, to be out having to fix it all the
Mhm.
time. So I went into a deep dive and thankfully, I had people in my path like Dr. Rosen or Dr. Neel. And so it really challenged me to learn more and work through it. And I'm excited to be going for his advanced training in March too, to Neil's. So
Yay.
I learned a lot more. So I put all of this together in my own way, and that's how we have started this collaborative team.
Oh, that is absolutely incredible. Thank you so much for sharing this amazing hour with us. Everybody,
You're welcome.
reminder, Maya Circle starts August 1st. Registration is open now. The next foundations course, which is more of introductory, however, it's the most comprehensive introductory course out there. Even people have taken 2 and 3 courses. When they take foundations, they go, what? Every January. So we only teach our courses once a year. Come join us. And then I have another announcement, which you guys probably know about this by now. We have created 2 different workbooks. The biggest issue as a myofunctional therapist is compliance, patient compliance. And we give them little sheets that they can fill out. Most people don't print it out, and it's just been a very big struggle. So I've had this on the works for 2 years, and it's finally published and printed and copyrighted, and we have it available for other therapists, for patients to purchase, however you guys want to do it. It's called the Mini Moves Workbook. It's for patients up to 10 or 12 years old. When I'm seeing a patient and they're around that age, I usually ask, okay, I have a child, a pediatric workbook, and I have an adult workbook. Which one would you like? It depends on the child. Like my 11-year-old will be like, no, I need the adult one. And the kids, of course. I mean, I do have some 11-year-old patients that are like, I want the kids one because there's like little activities that they can do in there. There's like, did you knows? Really cool information. They do them with me during therapy. And then I know you guys can't see because it's blurred, but there's an exercise list here. So they write down their exercises on one page. And then they have little check boxes that they can check off whenever they do the exercises. So every time I start therapy, they have to bring their book and show me how they did the week or the 2 weeks before. This has improved patient compliance tremendously in my practice, and I know it's going to help everybody else. So go over to the Airway Circle store on airway-centered.com, and you guys are going to be able to see the pediatric workbook and the adult workbook over there, amongst all the other cool things that we offer with Airway Circle with cups and t-shirts and fun stuff. But thank you guys for listening. Thank you, Dr. Samuel, for hanging out with us today. That was amazing. Any last
Thank
words?
you. No, I'm just excited to share what I go through, and I would love, love, love for more people to join on board and do what changes lives.
There he goes. Invite your local chiropractor to listen to this talk. Thank you guys so much. Have a wonderful day. Mwah. We'll see you next Thursday.